Yeah, is the screen visible to everyone?
Yes, sir.
Okay, good. Sorry, I could not take class for the last to last time, 2 subsequent classes. So I was busy with we had an inspection going on and I could not, balance out that time. So extremely apologies for the same. So now I'll just take you to the basic fundamentals of epidemiology. Okay. And then we will see like how to go about, how to understand the total things in perspective. Okay. So what is epidemiology? What is epidemiology? Yes, Alia. What do you think is epidemiology? Why do we need to understand epidemiology? Yes, Shivam. What is epidemiology?
Sir, study on control of like spread and control of disease.
Spread and control of disease. Okay, fine. Okay, fine. What else? Yes, anybody? Yes, Moirang Them, Alia, Akshay. Would you like to throw some more light upon it? What is epidemiology? Yes. So, yes, Akshay, Alia, are you there in the hospital or you are traveling right now?
Sir, traveling.
You are traveling, Akshay?
Yes, sir. In metro.
Okay. Okay, in metro. Okay, okay, no issues. Okay, now, now the thing is, I've already told you like what is health, right? So I told you like health is not merely an absence. So there are certain things that all of you should be very clear about, like what is health, what is disease, what is illness, what is sickness, what is public health. Okay, now we all know that hospital administration is a part of public health. What is public health then? What is public health? Because epidemiology is related with public health, then you will be able to understand like how hospital, public health and hospital administrations are interrelated with each other. What is the correlation between them? By the way, what is public health? Yes, Shivam, can you tell what is public health? हाँ शिवम, पब्लिक हेल्थ क्या होता है? क्या लगता है आपको?
Sir, not sure.
हाँ, but still.
Sir, like
मतलब हम पब्लिक हेल्थ हॉस्पिटल एडमिनिस्ट्रेशन, कल को मान लीजिए आप हॉस्पिटल एडमिनिस्ट्रेशन कर रहे हैं, आप कहीं के मेडिकल सुपरिटेंडेंट बन जाते हैं किसी भी हॉस्पिटल के, तो आप हाउ डू यू कोरिलेट, मतलब आपकी जो जॉब रिस्पॉन्सिबिलिटीज हैं वो पब्लिक हेल्थ से कैसे कोरिलेट करती है? हाउ डू यू फिट इन?
like sir, public health is like promoting health like through any organized efforts, या फिर sir like
Okay.
like any inform to society or like through organization.
Okay, तो आपने कहा कि आप कुछ इंफॉर्मेशन दे रहे हैं, आप हेल्थ को सेफगार्ड करने की कोशिश कर रहे हैं, यू मीन टू से सो, राइट?
Yes sir.
अब now but you are studying hospital administration, so hospital administration, how hospital administration and public health are correlated, they can be interrelated, how? Okay, Alia, any response from your end you would like to add upon this point कि कैसे ये पब्लिक हेल्थ, अब यहाँ पे देखिए आप डेफिनेशंस में लिखा है हेल्थ क्या होता है, डिजीज क्या होता है, इलनेस क्या होता है, सिकनेस क्या होता है, पब्लिक हेल्थ क्या होता है. So how do you feel like why this you are studying this subject under hospital administration? इसको पढ़ना क्यों जरूरी है, क्या समझ आएगा हमको इससे? Miss Alia. Okay. Moirangthem. मोइरंगथम का नाम लिया, मोइरंगथम गायब. Okay. Anyway, so see, आप एक हॉस्पिटल के हॉस्पिटल एडमिनिस्ट्रेटर काम कर रहे हैं, ठीक है. अब अगर आप एज अ हॉस्पिटल एडमिनिस्ट्रेटर काम कर रहे हैं, तो दैट मीन्स आपका अल्टीमेटली गोल क्या है, आप क्या कर रहे हैं वहां पे. शिवम, आप अल्टीमेटली क्या कर रहे हैं हॉस्पिटल के अंदर एज एन हॉस्पिटल एडमिनिस्ट्रेटर? अगर आप काम कर रहे हैं तो हॉस्पिटल का क्या काम होता है?
So to provide complete like treatment to the like to patient
तो
on
हम
disease.
इसको अगर प्रॉपरली डिफाइन करेंगे तो आप हेल्थ सर्विसेज प्रोवाइड कर रहे हैं, isn't it? अब
Yes,
वो
sir.
दैट कैन बी प्रिवेंटिव, दैट कैन बी क्यूरेटिव, दैट कैन बी प्राइमरी, इट कुड बी ऑफ एनी सॉर्ट, isn't it? सो
Yes,
आप
sir.
हेल्थ सर्विसेज दे रहे हैं. अब हेल्थ सर्विसेज किसके लिए दे रहे हैं? समाज के लिए दे रहे हैं, पॉपुलेशन के लिए दे
Yes,
रहे
sir.
हैं, है ना. ये
Yes, sir.
लोग आदमी गवर्नमेंट हॉस्पिटल में सफदरजंग में भी ले सकता है और आपके प्राइवेट हॉस्पिटल में भी ले सकता है, राइट?
Yes, sir.
Now what you are basically doing, so public health is basically, public health क्या होता है? It is nothing but applied epidemiology. That is, we are basically trying to manage the health of the people at a population level. अब मान लीजिए mass vaccination है, so your hospital can be a part of your mass vaccination process if suppose means calamity like COVID has happened, isn't it? तो उस टाइम पे जब कोविड हुआ तो गवर्नमेंट प्राइवेट हॉस्पिटल्स को भी तो सेंटर बनाया गवर्नमेंट ने, यस और नो?
Yes, sir.
अब अगर उसका उस टाइम पे अगर द सर्विसेज वुड नॉट बी हैव बीन प्रॉपर, देन व्हाट वुड हैव हैपेंड? इट वुड हैव कॉज्ड एनी टाइप ऑफ कैलामिटी, है ना. वो तो इसमें प्रॉब्लम हो जाता है. तो बेसिकली क्या है कि पब्लिक हेल्थ इज बेसिकली, इट इज बोथ अ साइंस एंड एन आर्ट of three things. When you are talking about a population level, there are three things. One, you want to prevent the disease. Second, you want to prolong the life of a people, and you want to promote health and efficiency. Now when you are saying such thing, hospital is an integral part of such a scenario, right?
Yes.
तो इसलिए हॉस्पिटल इसमें रोल प्ले करते हैं. तो कमिंग ऑन टू द एपिडेमियोलॉजी पार्ट, सो अब जैसे मैंने पहले भी आप लोगों को बोला था कि एपिडेमियोलॉजी को सिंपल वेज में याद रखने के लिए क्यों, कहाँ, कब, कैसे, क्या, when, where, what, how and why, okay, of disease you should know. So if I take these components, तो I can tell like it is the study of the frequency. तो कितनी बार हो रही है कोई डिजीज, कहाँ पे हो रही है, उसका डिस्ट्रीब्यूशन कैसा है, उसके डिटर्मिनेंट्स क्या है, क्यों वो डिजीज फैल रही है ना, एंड अदर हेल्थ कंडीशंस, health related conditions at a human population level, and the application of this study to the prevention of the disease and the promotion of health. तो आप ये बेसिकली किस लिए पढ़ रहे हैं? ताकि आप इस सब्जेक्ट को अप्लाई कर सकें for the prevention of the disease and the promotion of health. So there are two important aspects. So what is the basic goal of any public health? You want to prevent disease. Now in a hospital, if suppose you have got a preventive health care, so that is to prevent disease. In a hospital, you are doing a vaccination drive, that is a preventing a disease. In a hospital, you are doing any type of a treatment that is for prolonging life to mitigate the effects of the disease. Yes or no? Yes, Shivam.
Yes, sir. Yes, sir.
Okay. So today, because the rest of the other students are not responding, so I will be communicating with you because I require some students so that I
No
can
problem, sir.
we can exchange words. Okay.
Yeah, no
Because
problem, sir.
Alia is also not responding and Moirang Them is also not responding. So and Akshay is there in metro. But anyway, so this is one of the important aspects. And the
Yes.
third important aspect is we want to promote health as well as efficiency, because when you talk from a hospital, यही management की भी परिभाषा होती है. Like I said in the previous class, management को अगर हम 3 words में तोड़ दें, manage, men and T, so I am basically talking about managing the health. Men can be replaced by resources. These resource can be a human resource, can be an infrastructure resource, can be a financial resource, can be a technological resource, effectively and efficiently, right? Remember
Yes.
it?
Yes.
Okay. So when I am taking all these things from a disease perspective, now I am going more technical. So I first need to know which disease I am concerned about. So I take about a particular aspect a particular disease, be it tuberculosis, be it Kala Azar, be it COVID, be it lifestyle disorders, hypertension, diabetes, or could be any, endemic disease. So what I'm trying to look at, we are trying to look at the disease component. And public health is nothing but it is applied epidemiology. What you are studying, a disease kahan hua, kaise hua, kyun hua, कौन से फैक्टर रिस्पॉन्सिबल थे, इसका इम्पैक्ट क्या था, इससे इससे क्या किस तरीके का मतलब which population did it affect, okay, how fast or how slowly it spread in this population. So epidemiology are going to give you answers about all these things. And now suppose you are running a hospital, you are giving healthcare services, you are working as a hospital manager, you are looking after the healthcare services. So definitely all these information is going to help you to plan your services in a better manner. If you are able to plan the services in a better manner, then what will happen? There will be no mismanagement. If there will be no mismanagement, then what will happen? You will get the desired outcomes.
Yes,
Is it
sir.
clear, Shivam?
Yes, sir.
Okay. So that's why we need to understand the epidemiology. So like you can see in the slide, epidemiology is nothing, but it is basically, what is it? It is,
It is a study of
yes, it
frequency
is the study of the
distribution.
frequency distribution and the determinants of disease and the other health related conditions, right? So
Yes, sir.
this is basically epidemiology. Okay. Uh, just a minute. Sure. Okay. So that's why, and the application of this study, we are using this subject as a way to prevent the disease, to promote the health and prolong the life. Okay. So these are
Yes.
the various aspects that we need to understand in epidemiology. Now, based on these, we need to understand second, what are the components of these definitions. Now, first word which appeared over here, it is a study, because the word epidemiology, now logy means study, right? So
Yes, sir.
epidemiology is when you talk about, when you are saying it is a study, you want to study it, you want to undergo the salient features of these signs. So what you are doing is, we are doing a systematic collection. So it is talking about how you are doing a systematic collection, how you are doing an analysis, how you are interpreting the data. So epidemiology will involve the collection, analysis, and interpretation of health related data. Okay. So like sample, if I have to study, suppose I have to study about COVID. So from where I'm going to collect the sample? Should I collect it only from one state? Should be able to collect it from one area, or I should be able to collect it from entire country? If entire country, what should be the sample size? Okay. Then like it will also involve a lot of, like how we are going to do the sampling, whether I'm going to use a probability sampling or a non-probability sampling. Had it been a probability sampling, or so what type of a methodology, whether it is going to be a systematic sampling, stratified sampling, okay, randomized sampling, or if it is a non-probability sampling, then whether I will be using a quota sampling or a cluster sampling. So I will be teaching you all these things. But this is all about collection. Once you have collected, then what was the place of the study, then you need to analyze it. Okay, you need to understand the data, कि इससे समझ क्या आ रहा है, what I am able to comprehend out of it, है ना, what type of an information if it is giving to me. अब information तो तब दोगे ना जब आपने क्वेश्चन सही पूछा होगा. अब आपने क्वेश्चन ही गलत पूछा होगा, तो information कहाँ से आपको सही मिल जाएगी, right?
Yes. Yes, sir.
And then once you have analyzed it, then you need to interpret the data. So epidemiology is all about the science which is related with the health related data, and therefore it is a science, right? Second is like when I'm talking about any disease, so there are three things that I need to be very means it is very important to keep in my mind, like which place it is happening, which time frame it is causing, and what are the factors which are causing. ओके, सो
Mhm.
टाइमलाइन बहुत इंपॉर्टेंट है कि आप टाइमलाइन के हिसाब से ही हम इसको रेट्रोस्पेक्टिव स्टडी कर सकते हैं, प्रोस्पेक्टिव स्टडी कर सकते हैं. फॉर एग्जांपल, मैं आज डायबिटीज, सपोज इफ आई एम टॉकिंग अबाउट डायबिटीज, so I should first know like how diabetes is caused. Okay,
Mhm.
so if diabetes is being caused, then I am able to see why diabetes is happening. So like which population diabetes is basically affecting people. Okay, whether I'm talking about those people who are over 40, those people over 60, or those children who may be just over 10 years of age. If I am seeing such a phenomenon, if that is
Yes.
the case, then what are the factors which are contributing it? Then which type of a out of the various factors, and this which whether it is affecting male or female more. So there are certain aspects depending on the questions which I am asking. I need to search for those answers, and epidemiology is the science which is going to help me to seek those answers. Okay. So before, like for example, like COVID happened. Like for example, now lumpy disease. Okay, so lumpy has strike the animal population, the cows, and how it is going to affect the people, how it is going to affect the human population. So that could be also a type of. So you can also see the interaction. You can see the impact of the various diseases. So first of all, we need to understand what is the frequency, how many times. Now, if it is not happening so many times, then maybe it is not of an important consideration for you. But suppose if it is happening a number of times, then you really need to be quite thoughtful, like whether it has the it can go into becoming an epidemic and can also become a pandemic over a period of time, or it is just like you are only seeing the sporadic cases. Okay, so the number of times an event is occurring, and epidemiology basically studies the number of times a disease occurs, and it answers the questions how many. So it is giving you an answer how many. So epidemiology is a quantitative science. Is it clear?
Yes.
Yes,
Okay.
sir.
Then yes, Alia, welcome.
Sorry,
How
sir.
are you?
Yes, I'm good, sir. How are you? Sorry,
I'm
sir.
good.
Actually, I was traveling. I was driving. I just reached home.
Okay, okay, no
Yes.
issues, Alia. And even I am sorry I could not take 2 classes before. I was busy. Okay, it
Acha,
might
acha.
happen at times. Okay, but I will
No
compensate
problem.
for
No
any
problem, sir.
class
Not an
because I
issue.
keep up very busy, or sometimes I'm not able to because of my hectic schedule. Okay, but
Okay, no
anyway.
problem, sir. Yes.
Okay, so the third thing is like about the distribution. So Alia, is the 2 points clear to you about the study and the frequency, about the components of the definition of epidemiology? Are the first
Yes,
two
sir.
points
Yes,
clear
sir.
to you?
Yes, sir.
Okay, then the third thing we come to the distribution. So when you talk about distribution, this is what I was saying, कि which population is getting affected by it. So you need to define everything. So अगर आप disease कोई भी देख रहे हैं, suppose आपने कहा diabetes है, आपने कहा हाइपरटेंशन है. अब आजकल एक नया देयर इज अ न्यू डिबेट इन द इंडियन कंटेक्स्ट कि लोगों को आजकल 30 इयर्स में ही हार्ट अटैक आ रहा है इंडिया में, है ना.
Yes.
पीछे देयर वर लॉट ऑफ
Mhm.
रिपोर्ट्स, इवन लाइक some of the film stars also died quite young, huh?
After
And there were
COVID.
and similarly see now अभी जब से साइरस मिस्त्री की डेथ हुई है, तब से लोगों को रोड सेफ्टी के ऊपर लोगों ने बात करना शुरू कर दिया है कि भाई मींस पीछे की सीट पे व्हाई इट इज इम्पोर्टेंट टू पुट अप a belt, right? So that means whenever certain incidences are going to happen, it is going to attract the attention of the public, and you really need to understand like epidemiology will help to understand the things quite scientifically. So second thing is distribution. When I am talking about distribution, so it is talking about, so it is emphasizing upon the point like distribution of an event by person, place and time. So suppose distribution of an event by person, like which population it is affecting, and then place, like Suppose if I'm talking about lumpy, now lumpy is affecting the Rajasthan population much more than any other parts. Maybe the northern belt of India has affected more as compared to the southern belt. Okay, so likewise, you really need to understand, like, is there a important factor which is contributing to the spread of this disease in this region? So this is the distribution. And then time, like, how early, like, it is a measure of time, like how fast the disease is spreading. Okay, yes, like for example, like COVID. Why COVID was so much dangerous? COVID was so much dangerous because in the evening, suppose you have seen the person good, but in the night and by morning the person died. Why? Because there was a cytokine storm. As a result of the cytokine storm, the person lungs get infiltrated with COVID, and at such a pace that the body cannot respond by means of providing immunity, and as a result of which the person died. Okay, so it is a distribution of an event. We basically explore it, we basically define it by means of person, place, and time. Is it clear?
Yes, sir.
Okay, so
Yes, sir.
epidemiology will study the distribution of the diseases. It is going to answer for the question who, when, where, and when. Okay, so the first thing, frequency, is how many. So that's why I said you always remember epidemiology with a, like I said, kab, kyun, kahan, kaise, kya. Okay, so if you are able to answer these 5 questions, then your things are defined. And as far as how many is concerned, it is giving you the frequency. When I'm talking about the distribution, it is telling you the point, who is getting affected, who gets affected, where it gets affected, and when does it get affected. So who, where, and when. And then comes the last, so it will describe the health events. And last but not the least, we are going to talk about the determinants. So the determinants, like, what are the factors that affects the presence of which affects the concurrence and the level of the events. Okay, so epidemiology studies what determines the health events. Like, it answers the question how and why. Okay, so which factors are contributing to it? Which factors has increased it? Which factors have caused the likelihood? So these factors are very important, and understanding these factors, by understanding these factors and the various events which we just discussed, we can then discuss like how it has to be you managed. Okay, so these are the important. So are these 4 components clear to everyone?
Yes, sir.
Okay. Then comes the fifth component, that is diseases and the other related events. Then epidemiology is not only the study of the diseases, it is not only the patients, but it is all related to all the health related condition. Okay, so it's a broader science. So it is also talking, it will be also giving you the perspective, social perspective, economic perspective, demographic perspective. Okay, the cultural perspective. So it will include, it's a quite a broader, and that's why those people who are belong to the science of public health or epidemiology, they are from multi-diversified background. They will be medical professionals, they will be from social work department, they will be from rehabilitation department, they will be from laboratory sciences, they will be from sociology, they will be from social work background, right? So they are dimensional, because the disease or the when you talk in terms of epidemiology, they have got multiple perspective and multi-level perspective. Okay, and as far as your human population, like I told you, epidemiology will diagnose and treat all the communities and the population. And it will while the clinical medicine, if you are studying any clinical medicine, that is going to diagnose and treat the patient, whereas epidemiology or basically this epidemiology is the basic science of health, and it is nothing but applied part. And as far as the application of the epidemiology is concerned, epidemiological studies have a direct and practical implications because they will help in not only just preventing the disease, but also promoting the health and prolonging life. And it is both an science and an art. And like I told you, it's applied epidemiology. Public health is applied epidemiology. Is it clear?
Yes, sir.
Are these points clear? Yes,
Yes.
Alia.
Yes, sir.
Okay, then let us understand what are the various landmarks in the history of epidemiology. So all of you, like Hippocrates in the 460 before Christ, he emphasized upon this part that whenever you are talking about epidemiology, the environmental and the human behavior affects the disease, affect the health. So they told it quite before, like in the 460 BC, before Christ. Then later on, when in a scientific way, when it was studied, then the John Grant, he basically first quantified for birth, death, okay, and the diseases. And like Lynn in the 1747, that was the time when the Renaissance period took place, and scurvy, and he basically emphasized for the first time that scurvy can be treated with fresh fruits. Similarly, William Farr established the application of statistics for the evaluation of the health problems in the year 1839. And similarly, like John Snow tested a hypothesis in the origin of epidemic of cholera. So these were the various landmarks, and then Bradford Hill basically suggested the correlation for causation, like what for every disease will have a certain cause, and based on those causes, the treatment has to be means emphasized. Okay, so
So,
uh, these are the important landmarks.
so this is for the knowledge or या फिर एग्जाम्स में भी आ सकते हैं
नहीं नहीं, ये सिर्फ नॉलेज के एग्जाम,
knowledge
कोई नहीं।
okay okay
जैसे एग्जाम में पूछ भी इस बार तो मेरे ख्याल से पूछा था, बट वो पब्लिक हेल्थ में पूछा था, इसमें नहीं पूछा कि
okay
एपिडेमियोलॉजी का ब्रीफ हिस्ट्री बताओ। एनीवे कौन कौन से इंपॉर्टेंट लैंडमार्क्स, बट नेवरदलेस, मतलब देखिए आपको एक मोटा मोटा कई टाइम होता है ना कि ये ब्रांच कैसे आई थी, हाउ डिड इट ये किस तरीके से फ्लरिश हुआ था। So originally, firstly, जब the branch of epidemiology came into being, then it was concerned basically with the investigation and the management of the epidemics of only the communicable diseases. Then lately, it was extended also to the communicable as well as non-communicable diseases. Whereas now, epidemiology can be applied to all the diseases and all health-related events. Okay. So it can include all different type of disease. So the area and it is quite a vast science. Okay. So now coming to this part, like why we need to, what is the purpose of epidemiology? Why do we study epidemiology? So I have already told you, we are studying epidemiology for the purpose of promotion of health, for the prevention of disease, okay, for prolonging life. So how does it take place? How does this branch will help in such a scenario? So this is basically by understanding the elucidation of the natural history of diseases. And secondly, when we describe any type of health status of a population, like what is the general age of this population, which type of a diseases does it affect, what type of a lifestyle do they have, what type of behavioral history they have. So these are the that these things, these information are going to help in this manner. The third is like when you then you establish the determinants of disease. Okay, what are the different determinants of disease, and then you want to evaluate for the intervention effectiveness, like whatever intervention you want to give. Okay, and then you want to decide on terms of like how these interventions have played an important role in the management of the problem as a whole. Is it clear?
yes sir
Similarly, when you say epidemiology, there are two aspects of epidemiology. Like there are two types. One is a descriptive epidemiology. Second is an analytical epidemiology. And I have also told you. Similarly, because epidemiology cannot be just understood like this. Epidemiology needs to be understood from the perspective also from biostatistics. Now, because biostatistics is a very important component, I just want to understand like what is biostatistics, because you will be also studying biostatistics and how it is related with epidemiology. Yes, what is biostatistics and how it is related with epidemiology. Then I'll come to this part, like why I'm asking such a thing. Yes. Yes, Alia.
So, biostatistics, it can help identify the best way to, treat or to find the source of the disease, or, treat the disease in certain population.
Okay. Okay. What else? क्या होता है? आपने कभी पढ़ा है स्टैटिस्टिक्स? पढ़ा है आपने कभी ये सब्जेक्ट स्टैट्स? यस आलिया, पढ़ा है कभी?
No, sir, never.
नेवर. ओके. यस शिवम, आपने पढ़ा है स्टैट्स?
No, sir. No, sir.
ओके. बट आपका कम्युनिटी मेडिसिन में तो आपने थोड़ा तो देखा होगा ना उसके तो क्वेश्चन, आपका
Sir,
प्रोबेबिलिटी क्या होता है, ये सब क्या
sir,
उतना देगा
long
सब
back.
कुछ.
Long back,
लॉन्ग
sir.
बैक. ओके. Okay. So statistics is the science of concluding from the data. So like I have already told you in the last class, why is data important? Data is helping us to give information. That information, so data is being used to give information in investigation. Okay, so data will give us information. Information has to be converted into knowledge, and knowledge has to be converted into wisdom. Right? Do you remember I told you?
Yes, sir.
Data into information, information into knowledge, and knowledge into wisdom. That's why, and the statistics is the way to understand those datas, to describe those datas, to explain those datas, to interpret those data. So that's why these things are very important as far as the biostatistics is concerned. And biostatistics are of again, there are two branches of biostatistics. There's a descriptive statistics and there's an inferential statistics. Same like on your screen, you can see there's a descriptive epidemiology and there is an analytical epidemiology. Analytical epidemiology is nothing but inferential epidemiology. Okay, so inferential means how you can understand the overall data. Like suppose you have done a study on 100 subjects. So you are treating each and 100 subject. You are trying to evaluate the outcomes based on those 100 subjects. But at the end, I need to conclude that what do we understand from this phenomena? What did we learn from this phenomena? And how is it going to help in further researches? Is it clear?
Yes.
So similarly, descriptive epidemiology will talk about the descriptive part. It will define the frequency and the distribution. Okay. So descriptive epidemiology, it will just define the frequency and the distribution of the disease. Distribution of the disease, I told you whether it is a man, what is the gender, and how the disease spreads. Like these are very important. Distribution I've just told you of the diseases and the other health related events. So it will answer your four major questions, that is how many, why, where, and when. Okay. So these are the four important questions that may give you. Is it clear?
Yes, sir.
Yes, sir.
And analytical, the other word for analytical could be inferential also. Inference. So we take out inference. So inference regarding the health problems, like how it is happening and why it is happening. How and why are an important proposition or the components for the epidemiology, especially like I told you, there are two types of epidemiology. One is a descriptive epidemiology and the second is the analytical epidemiology. Descriptive epidemiology means you are trying to describe it. Okay. And so you are defining it by means of how many, where, who, where, and when. And as far as the analytical or the inferential epidemiology is concerned, it is going to answers for the two questions, how it is happening and why it is happening. Is this clear?
Yes, sir.
Yes, is this clear? Okay.
Yeah.
Okay. And then we come to this point, like, what are the basic epidemiological assumptions? So basic epidemiological assumptions are, human disease does not occur at random or by chance. Okay, so these are the assumptions. Basically means the hypothesis. What hypothesis? For example, if I am taking drug A and drug B, and I'm comparing, suppose I'm comparing paracetamol with brufen. Okay, and then I'll design a research study and I'll take 30 subjects and will study that parameter on those 30 subjects, and then we are going to use another parameter in the next 30 subjects. But here the things are very systematic, because I told you when we need to design it, how we are going to design it. So we need to be have a very clear cut understanding. Okay, so when we make a hypothesis, we need to conclude that I am thinking like this, so that's why, and then this thing can be challenged by somebody else. So basic assumptions. So whenever you are studying epidemiology, you are going to take the basic assumptions first. Is it clear?
Yes, sir.
Yes, sir.
Okay, then what are the basic features of epidemiology? So the basic features of epidemiology are the studies are conducted on a human population, as you all know. Here we are going to study the patterns of the events in the body. Okay, why different types of patterns do occur, why doing so, and then it will help to establish a causal effect relationship, like what is the effect and how much, what is the effect and how it is being caused. Okay, so cause effect relationship, what is the impact of such a disease on the environment or the biological systems and all. And then it is will, like I told you, this will cover a wide range of conditions. Epidemiology can be related with anything, and it is also an advancing science. So, okay, so these are the basic features of epidemiology. Any doubts in this slide? Anything which is not clear?
No, sir.
Okay. Okay, now then let's now understand like the various technical aspects. Number one, like I told you, how a disease is being caused. So we need to understand the disease causation factors. Like the cause of a disease is like if there's an event, there's a condition or a characteristic that comes before the disease. That disease does not happen just like that. So we need to understand the source of the disease and the cause of the disease. Okay. So that's why what is the cause of the disease? The cause of the disease, like there could be a cause, there could be a condition, underlying condition, or there is a characteristic that will come before the disease, and without which the disease would not occur. Okay, so that is basically the cause of the disease. Now, what causes this disease? We'll come to this point. Like the first thing is to know, like Mycobacterium tuberculosis is responsible for causing tuberculosis. Mycobacterium leprae is responsible for causing polio. Okay, tuberculosis, Mycobacterium tuberculosis, and then the second one like zoster. Okay, so herpes is caused by zoster. So you have got different type of microbial agents for causing the different type of diseases. Then you have got other type of factors, for example, like diabetes. When you say, okay, there is a reduction in because the liver cells, the alpha liver cells are not being able to secrete enough pancreas, not the liver but pancreas, they are unable to make enough insulin which can be used. So it will result in such a disease. So what I'm trying to tell you is, there were various theories that were given, like why the disease is being caused. So one of the theory was a contagion theory, the second theory was supernatural theory, the third was a personal behavior theory, and the fourth was the miasma theory. And this is how it evolved over a period of time. So so these are the various types of theories that affect that are responsible for causing the disease. Then later on in the 20th century, the germ theories of the disease causation, the lifestyle theory, the multi causal theory, and the environmental theory became a important part. So these are the different type of theories that have been given emphasis on understanding of the branch as a whole. Then there are two concepts like necessary and sufficient. Like the disease will not occur without the presence of the factor. So that factor is critical for causing the disease. So then it is called necessary. At most, Also, like in management, we also talk about what is the need, what is the want, and what is need and want. Okay, so we always try to emphasize in this point. Similarly, here we are going to talk about what is necessary and what is sufficient. Now, necessary means the disease will not occur without the presence of that factor. For example, Mycobacterium tuberculosis. And similarly, sufficient is the presence of that factor always result in the disease. Will cause it sufficient. Is it clear? Like rabies virus for the rabies virus for the rabies. Okay, so it is enough for causing rabies. Is it clear? Are these points? Yes, and then we talk about the etiology of disease, like what is the cause of disease. Like I've told you what is the source, then the cause, like whenever we sum up all the factors, for example, the agent factors, the host factors, okay, the environmental factors, they will all be responsible for the disease epidemiology. Okay, so all the three factors, I've told you what agent it is being caused, like the microscopic agent, and the host factors, what are the factors which are present in that person which is causing it. Okay, and the third is the environmental factors. So how is the air, light, sanitation, vibration? So these are playing a very important role in the causation and understanding the disease causes. Is it clear?
Yes, sir.
Okay, so then we come to the various disease models. Now, like I told you, what is epidemiology? It is how a disease, kab, kahan, kyun, kaise, kya. So similarly, now we try to understand like what are the disease models that has been developed to understand the disease as per se. So it will give you the two answers for the question number, like how do the diseases develop? Okay. So the first answer, like how does the disease develop? In terms of, like, there are three best known models. One is called the epidemiological triangle, the second is called the web of causation, and third is called the wheel model. Okay, so these are the different types of models. So let us understand the various models one by one. The first is the epidemiological triangle. So epidemiological triangle will say, like, there's an agent, there's a host, and there is a so there's an agent and the host, which will result in the causes of the disease in a particular environment. Okay, so if we make a triangle and we say this is the agent, and then the second is what type of an environment it is being, the person is being living, and then what type of a disease will it cause. So this is the epidemiological triangle. Is this point clear? What is an epidemiological triangle?
Yes, sir.
Okay. Then come the web of causation. Web of causation says, like, it talks about the various factors, the social factors, the economic factors, the demographic factors, the education factors. So we study the whole different type of factors to see the effect of the result of the uh, of the various factors upon the disease, isn't it? So how these factors are interacting with each other, how one is good, one is bad. And then the last but not the least is called the wheel model. The wheel model will say, like, there's a hub in between. So like in the hub means, like, we have the phenomena, like, uh, just okay. So we have this, like, suppose this term. So suppose we are creating So suppose we are creating a wheel. Just what happened? Like, so suppose there's a wheel, and in the wheel there's basically a hub. Okay, the central part, and then so the central part is called the genetic makeup, because that is the part which we got up from our parents. Okay, and then all of us are being subjected to different type of surrounding environment, class, social class. Okay, which will be schematically divided into so this is basically your wheel model, which is causing an effect on the person, and that will have a different effect based on the biological, physical, and the social factors. Okay, is it clear?
Yes, sir.
So today's class we have just finished till slide number 20. I'll just share this slide in the group, and then we will start with the slide number 21 in the next class. Okay,
Okay.
so
Okay.
we will have the natural the history of disease.
Okay,
It
sir.
is 162 slide. Okay, so we
Yeah.
will finish it in this almost like a month or so. Okay, so that we
Okay.
understood. Okay.
Okay,
Yes,
sir.
any doubts? Yes, Ali, any doubts?
No, sir, no doubts.
Okay, okay. So I'll just share this thing in the group, and then you also study it, then and then we'll move further. Okay.
Yes, sir.
Okay. Thank you, sir.
Okay, bye. Bye.
Thank you, sir. Bye.